What is up, guys? Welcome to the video. We are in New York City right now. I'm walking over to my appointment with Dr. Ron Shelton at the Laser and Skin Surgery Center of New York. I can guarantee you one thing. I am sweating my ass off. I am wearing the wrong attire to be walking in New York City, as well as the wrong shoes for New York City. But we got this appointment. I'm about a minute late. I have about another 5-minute walk. I would have taken a bus to get there because I took a train to get to 34th Street and Herald Square. But the bus that I would have taken literally was not in service and just passed right by me. And at that point I knew we were on foot for the rest of the trip. So we have to get over there. It's definitely loud in the city. You can definitely tell by the way I'm talking that there's gonna be little pauses as I'm walking down the street, because there is literally no way you're gonna hear me at certain points, like with a siren coming behind me right now. That being said, I will see you guys at the doctor's office.
You know, I think, as I said, we can improve but not remove the scars.
Okay.
Your dermatologist can continue to inject them, but not within a couple of weeks after we do a laser.
Is this a one treatment or multiple?
Multiple treatments. It's
Okay.
a series. You're looking at repeating, depending on how your skin responds, between 8 to 12 weeks. How many will you need? It could be 5, 6. One thing to consider is doing a test area. Give you an idea about how long it's going to take and how you can improvise the wound care.
Yeah.
As we said, the throwaway shirts, dressing materials, etc. There is no predictability as to how you respond.
Yeah.
Everyone responds differently. So I do think that possibly using a product that can help improve the elastic tissue and the collagen in your dermis, something called elastin. The elastin transform used in conjunction with a laser may allow the laser to do a better job.
Okay.
To allow your healing.
Is this an oral?
It's a cream.
Okay.
We'll get you a quote so you understand the cost of the procedure, which is based on area. But if we do need to give you medication that's going to affect, let's say, the pain level, give you a narcotic, if we need to give you a pill to relax you, then you're going to need an escort to pick you up.
Yeah.
If we're able to give you some Tylenol, the laughing gas, some numbing cream, and possibly, if it's smaller areas, to actually inject the local anesthetic, then you don't need it. This is not, in terms of safety, something that we can inject the entire back with local anesthetic. It's just too much volume.
So we'd have to do it in pieces.
If we do need to do the local, yes.
Okay.
Yes. And as it is, just from the numbing cream standpoint, and the practicality of wound healing, it makes more sense to do the back, let you heal. This way, just sleeping at night, if you find it very uncomfortable, you can at least sleep maybe on your stomach or on your side. And then when you get to have that heal on the back, then you can do the chest, and we can keep alternating.
Yeah.
We're healing with laser. We want you to heal well. We don't want you to grip good skin.
Right. I guess, what do you think the odds are that, like, in the next year I can get my skin to be somewhat flat or the coloration change? I guess, like, my end goal is to have, like, not necessarily perfect skin, because I guess the end goal for me really is to compete and have skin that looks even toned. Is that possible?
In any event, Sculpture is a seed to help your body mount more of a collagen production.
Okay.
We take advantage of the fact that there are these tiny channels from the low-dose fractional laser.
Mm-hmm.
Apply the Sculpture right after, so we don't have to inject it.
Mm-hmm.
And the combination of them at times has helped light skin from scar rebound to a little bit more normal color.
Yeah.
But not always, for sure. There isn't necessarily a finite number of times you can have the treatment. The problem, of course, is, as you were alluded to, it's a question of time. Will it be a year? Will it be years?
Yeah.
And that I cannot tell you.
Sure. Okay.
Before we were doing this fractional low-dose carbon dioxide along with a topical Sculpture, there wasn't really much to offer you.
Mm-hmm.
And we've seen some really nice improvements. But I've also seen some patients where we couldn't get it to budge enough. I don't think so.
Okay.
You know, if you have a treatment, I'd rather you be local for 2 weeks.
Okay.
Within 2 weeks, that should be enough time to really let things settle down and you can travel.
Okay.
Then even a few days later, you should be fine in that regard.
Yeah.
But others have more of an exaggerated response, and it could take a week and a half to maybe 2 weeks.
Okay.
Aside from the pricing, you know, the risks really are, can't guarantee the results. There
Right.
could be no improvement. Anytime there's laser, there's a rare risk of scarring.
Yeah.
You know, you're trying to improve scars, and then, you know, is there a secondary infection? Is there an exacerbation of hidden acne? Does it wake up? Does that then cause new scars? And the coloration, anytime there's laser, there's a rare chance of what we say post-inflammatory hyperpigmentation.
Mhm.
With your fair skin, you're not at high risk of that, and you've kind of done the test, you've had acne, and I don't see brown spots.
Right. Right.
Questions, let me know.
I appreciate it.
My pleasure. Please, I'll send a report to Dr. Sherrill.
All right. Thank you.
You're welcome, and I wish you good luck.
I appreciate it.
All right.
Okay, guys. See you today. You too. Oh boy. Alright guys, so we just got over to the gym. We're at Impact Zone. I am dressed and ready to go, and that was an exhausting process. Not gonna lie, I'm not happy. I'm a little disappointed, and I'll get into why a little bit later, but I have to go get this chest and shoulders workout in. It's gonna be primarily shoulders, but probably gonna do like 4 shoulder movements, 2 chest, and maybe a try or 2 just at the end, because my arms also need to come up as well, so we sprinkle them in a couple times a week. But yeah, that being said, I'm gonna go get this workout in, and we'll catch up afterwards, talk about what the doctor actually had to say and what I'm feeling about it. Let's go. Come here, come with me.
Oh, I follow. Wherever his hand goes, I follow. Dude, this is so weird. It's so weird.
What, we're holding it?
Nah, just like I'm in front of the camera all the time.
You want to be in front of it?
No, it's all okay. Nah, but like I'm just saying, like I'm not used to that.
You're like,
this camera's absurd. Or it's the lens.
I know, it's like, it's mad nice, you know?
That's
hold on,
fun.
spot
Holding
focus. Hold that shit. See? Damn.
Damn.
Hey. What's up, Mike? See you, buddy. Okay, so I just wanted to finish up talking to you guys about what the doctor basically said about what we're gonna do about my skin. So he suggested we do a laser restructuring type of therapy. I have large surface area to fix, right? I have my full back, I have my chest, and I have my shoulders. Now the main concern is obviously my back in the middle of my chest. In the back, we have depressions, we have raised marks in the front, and so we have to find a way to fix them both. You can use the same laser therapy to fix them both. However, they work a little different. We have to make sure that we do it in pieces. Unfortunately, the pricing is pretty rough. So I'm not gonna lie to you guys, I balked pretty hard when I saw the rate sheet for this. It's $1,500 per session for every time I do the laser therapy, and that only covers one part of my skin. So if a part of my skin needs multiple laser therapies, and say we break it into 7 or 8 different sessions to hit every part of my body that needs it, we may have to go over it a couple times, 1 to 2 or 3 times maybe in an area, which kind of sucks because that means we could do 7 or 8 different areas and we could do them 1 to 3 different times. That would run me anywhere between $8,000 and $20,000. It's a lot of money to fix my skin. I was disappointed. I was definitely disappointed. I know right now I have a lot going on my plate. I have a lot of things I need to be able to afford, and I don't know that the skin therapy, the laser therapy is exactly what I can afford right now, and when I can do it. So that being said, I'm going to continue to consult doctors. I'm going to continue to go see other dermatologists in the New Jersey, New York area and see who has an option for me that's feasible. Something that I can do to repair my skin, maybe at a more affordable cost. I understand this is going to cost me thousands of dollars. I understand that this is a huge procedure and I want the best person doing it and I want it done right. But it's all about right now the hierarchy of priorities, and my priority right now is to just get better. And so we will cross that bridge when we get to it. I don't know if laser therapy right now is exactly what I need. I don't know if that is something I will do at any point, but right now that is the only option that's been laid out, and I'm going to explore other options. So that being said, guys, I appreciate you guys following along. I don't have answers quite yet, and you might be looking for similar answers to your own scenario. Best believe I'll be documenting the rest of the process, the whole journey. We will find out what exactly we need to do to get better. So that being said, guys, I appreciate you guys for watching. Keep getting better, and I'll catch you in the next one. Peace.
A new place, a new home for a while. Let me feel alive.